So everybody here knows that the gastrointestinal tract is divided into the upper portion and the lower portion. Okay, so the portion that is above the ligament of Trex is the upper GI. Then the area that is what below the ligament of Trex is the upper GI that's above the ligament of Trex. Okay, below the ligament of Trex is what? The lower GI. Okay, so we get to look at the differences between a bleeding that could occur in the upper GI and a bleeding that could occur in the lower GI. Okay, so differences between the bleeding from upper and lower gastrointestinal tracts. Okay, so we get to see this one is what upper GI bleeding, this is lower GI bleeding. Okay, just a picture looking at the various causes of lower GI bleeding. Okay, so let's have a comprehensive comparison between the two concepts. Okay, so here is a comprehensive comparison of bleeding from the upper and lower gastrointestinal tract. So first of all, we'll talk about the upper gastrointestinal tract before we now talk about the lower gastrointestinal tract. Then we'll now go to talk about the key differences between the two concepts, right? Now, for the upper gastrointestinal tract, it's a bleeding that is originating from what? Any area that is proximal to the ligament of Trex. So that means the area is before the ligament of Trex, okay? So areas like what? Esophagus, the stomach, the duodenum, all right? Characteristics. Common causes include peptic ulcer disease, esophageal varices, gastric cancer, and Mallory-Weiss tears, right? Symptoms include what? Hematemesis, the person will be vomiting blood. Then the person will be passing out black tarry stools. I've already explained this. Black tarry stools is Melena. So why there's Melena is because the bleeding is occurring up here. So before the blood got to the anus, which is a distal location, the color actually what? Changes along the line, okay? So there will be abdominal pain, there will be nausea and vomiting, right? The vomiting which could be pure vomiting or accompanied with blood, right? Then diagnostic test. You could do upper endoscopy, you could do what? Barium swallow, you could do CT scan. Treatment include endoscopy therapy, medications, and surgery in severe cases, right? Then looking at the lower GI bleeding now. Lower GI bleeding is simply what? A type of bleeding that is originating from what? The area below, right? Any area below, okay, from the colon down to the rectum down to the anus, right? So it's originating either from the colon or the rectum or the anus, right? And this area is distal to the ligament of stress, or you would say it is what? After the ligament of what? Trex, okay? Common causes could be hemorrhoids, it could be what? Diverticulosis, where you're having a portion from the intestine, right? It could be diverticulitis, where these outpouchings are becoming inflamed, right? It could be colon cancer, it could be inflammatory bowel disease, it could be anal fissures. Symptoms. The person is passing out blood, and this blood is what? Bright red. Why? Because this bleeding is occurring to a place where it's close to the outlet. So the blood doesn't have to travel a long distance. So the color is maintained. Okay. So there's rectal pain, there's urgency, there's thinner moves. Diagnosis tests include what? Colonoscopy, flexible sigmoidoscopy, and CT what? Colonography. Alright. Treatments include what? Endoscopy therapy, medication, and surgery that could be employed in severe cases. Right? So the key differences between the two concepts, that's either bleeding from the upper GI or lower GI, is for location of bleeding, color and consistency of stool, symptoms and presentation, then the diagnostic test that could be employed to diagnose the condition. All right, so that's the difference between what? Bleeding from the upper and lower GI. That's basically what gastrointestinal tract.